through.
You
It's
said
not.
an arthritic spur in the coffin bone. You said.
Yeah, in the coffin joint. If you look right here, you want a rounded coffin bone. You want this to be rounded. If you look right here, it looks like we have a little point.
It goes
coming
up, yeah.
Yeah. And I think we probably have the same in this foot, although my angle
It's not as.
is not as square.
Yeah.
But even despite that, I'm looking at this area right here.
Yeah, that's not the same.
Right here of P2. That's kind of where your joint capsule for your coffin bone attaches.
Yeah.
And anytime you get a coffin joint that gets very effusive, you'll start to get calcification at that.
Well, that's what I was wondering because I could see that on the front. You
Mm-hmm.
can see it on his skin.
Yep.
Okay, so that's what that is. So, I mean, is there anything we can do about that, or
You can inject it if you need to.
do we need to now?
I don't know that I want to right now.
Okay.
Especially since what I'm gathering from you is you're just now getting him in a set of shoes, correct?
Yes.
I'd probably wait for 2 to 3 shoe-ins before I'd consider injecting his coffin joints.
Okay.
Those things can get flared up, especially while we're trying to monkey with getting his feet right and his angles right.
Mm-hmm.
And I think injecting him right now would probably not benefit us in the long run, as far as would rather get him good balance in a good set of shoes, make sure we're happy with the shoes, and then reassess his coffin joints. There's a good shot we may not even have to
Okay. Good deal.
inject them this early,
Right.
you know.
I just want to make sure.
Longer I can put off going into the joints, the better for me,
Yeah.
you know. But, you know, I think my standpoint is right now with where we're at, I'd rather change the shoeing and try to get all that right.
Well, yeah.
Couple shoeings down the road, if we're still having problems and you're still feeling down the right front, get him back here and we'll inject him.
Now, do you think this right front deal is having issues while I'm having problems with him going to the right?
It could be.
Because he hangs up bad with his head, like he wants to just goof me with his head and everything. I mean, just everything to the right is just a pain.
It sure could be. But there again, like I said, I think I'd rather work on the shoeing first for a month or 2 months.
Yeah.
1 to 2 shoeings, and then kind of reassess where he's
Okay.
at.
So how often do you think I need to have him shot? Just depends on his growth.
Well, it depends on the growth, but I mean, rule of thumb for me is every 4 weeks. I try to stick with every 4 weeks for one of these right off the bat.
Well, most people I've always heard every 6 to 8, but I mean, if you're 4 to 4, that's pretty sweet.
I'm for 4 when you're having a problem and you're trying to get a foot right.
Okay.
You know,
I see what you're
you see
saying.
what
Not
I'm
just
saying?
once they're correct, then
Once
it's 6
they're-
is
yeah,
fine. But when you're trying to
once-
fix an issue,
Exactly. Once they're correct and I'm happy with how the shoeing is, I can go longer with them after that.
Okay.
But I think for him, I would probably do once every 4 weeks for at least the next 60 to 90 days.
Okay.
Next 2 to 3 shoeings.
Okay.
And then
That's fine.
see what he's doing.
Yeah.
All right.
That's perfect.
Now, here's the next thing. Here's our left foot.
Mm-hmm.
Here's where that scar is right there.
Yeah. Look at that.
So, but that's not articular. That's not related to the joint.
Right.
But apparently whenever he did get cut, he got cut bad enough that he did do some damage to that bone. But it's not damaged right now. This is just what...
But he just grew back out when he's okay.
Yeah.
Okay.
Yeah.
Well, that's nothing to worry about then.
No. You know, if they ever sell them and have them pre-purchased, they'll probably point it out on a pre-purchase. But it's not active. It's not reactive. This is the end sequela of an old injury.
Right. So no big deal.
No big deal.
Good deal.
Now there's one other thing I'm gonna point out to you, and it's the thing everybody gets scared of hearing. Oh,
Oh boy.
left, right. We do have some early on vascular channels in our navicular bone.
Mm-hmm.
You see that? You see the black right there?
Yeah.
But I don't see, of course, this navicular bone, I can't see the whole thing because of the shoe, but I don't think we need to pull the shoe. I don't see any size and shape variations. I don't see any areas that look reactive right now.
Okay.
All I can say is we do have some vascular channels in the navicular bone. Not getting any pain on hoof testers, not getting a type of lameness that I would tend to see with a navicular.
Right.
And I don't have any sclerosis in there, but that is something we're going to want to keep an eye on here.
Okay. How often do you reckon I ought to get that checked or?
I guess a lot of it depends on if we have to start injecting his coffin joints, how often.
How it goes
Yeah.
and from there.
Yeah, if I start to have to inject coffin joints more frequently than I care to, I might re-x-ray that horse's foot to see what's changed in there.
Right.
My treatment for navicular changes or navicular pain, generally I'll recommend a little bit of a wedge shoe. Yeah, wedge shoe is what I'm going after. Some people put them in bar shoes, but I like a little wedge, a 1 to 2 degree wedge, and I'm gonna start injecting the coffin joint.
Right.
Most of my navicular horses, that's really all I need to do to them. I don't think he's a full-fledged navicular horse. I just think we have early on changes, and we're gonna want to watch that.
Just in case.
I think his foot balance and his coffin joints are the two problems we need to address.
That's probably why he's got the issue now already. A little small, whatever.
Yep.
What about his back, his hocks, and all his? He ought to be good.
I didn't see any change on flexion on his back end. I'm not getting any.
He seems fine on his back end to me. I didn't see anything, and I knew going to the right he was his front.
Yeah.
I could feel it and tell.
Yeah.
So that's
Yeah.
okay.
And like I said, the question is when to start injecting his coffin joints.
I'll just keep him shot here 4 weeks and.
I would rather do that, a couple shoeings and see where he's at. And I mean, you can kind of feel the fluid in the front of the coffin. It feels like a water balloon in there.
Yeah, I know, because I could feel it when I touched it myself, and I could see it.
If it stays feeling like that, once we feel like we have the foot more in balance, then we might just have to bite the bullet and come back and inject him.